ಲಕ್ಷ್ಮಿ ಆಂಟಿ ಎಲ್ಲಿ? Anemia in CKD is very common, and this CKD patients usually present with a generalized weakness, easy fatigability, unable to walk. Sometimes it can lead to comorbidities such as congestive cardiac failure. Causes for anemia in CKD patients mainly is because of erythropoietin deficiency. As the CKD progresses, the EPO production from the parenchyma of the kidneys decreases, and this can lead to anemia. Second is iron deficiency. There is called functional iron deficiency in CKD patients. Second, there is a decreased absorption of iron from the body. So there can be iron deficiency anemia in these patients. Third, patient will have vitamin B12 deficiency. This vitamin B12 deficiency can happen because of decreased absorption per se, or it can be because of loss of vitamin B12 during dialysis in the dialyzer. Fourth, because of uremia itself, there is an inflammation in the body, and because there is an inflammation in the body, this causes bone marrow suppression, as well as the decreased lifespan of the RBCs. So the other cause of anemia in CKD can be because of blood loss during dialysis. So these are the few causes of anemia in CKD. How do we treat? So first we will see what is the cause. If there is iron deficiency, we correct iron. Once iron deficiency is corrected, then we give EPO supplements. So we either give erythropoietin or darbepoetin. Now newer drugs have come, oral newer drugs have also come. Desidostat, which is hypoxic induced factor inhibitor, I think, that can also be used when you are suspecting EPO deficiency. So thank you. What? Road antara. Mada dancer. Hey, mada. Good afternoon. I am Dr. Dinesh, consultant nephrologist practicing in Bangalore. So our CKD patients usually they complain of weakness. So what is the cause for weakness in our CKD patients? The most common cause for weakness in the CKD patients is anemia. So why there will be anemia in CKD? Let us define anemia. Anemia is characterized by decreased number of RBCs RBCs to carry the oxygen, okay, from the lungs to the body. So when there is decreased anemia, so the patient can have generalized weakness, fatigue, difficulty in walking, difficulty in concentrating. Patient can also have congestive cardiac failure, like breathlessness on climbing the steps. So all these are a feature of features of severe anemia. So how do we classify anemia in normal population as well as CKD stage 1 and stage 4? We classify anemia when in males, if the hemoglobin is less than 13 gram per dl, and in females it is less than 12 grams per dl. In CKD stage 5, once patient is on dialysis, then we keep hemoglobin range between 10 to 11.5 grams per dl. This is to decrease the risk of cardiovascular events. Like once the hemoglobin grows more than 12 grams, studies have shown that patient can have cardiovascular events such as MI, clotting tendency in AV fistula, or there can be a stroke in the brain, there can be a clot in the brain. So these are the features of I mean, the events are more when the hemoglobin is more than 12 grams. So that's why we keep a range between 10 to 11.5 grams per dl in a CKD on dialysis. Now coming to the cause for mechanism of anemia in a CKD patients. See, there is a which is produced in the kidneys called erythropoietin, and this erythropoietin is very important in the production of hemoglobin. As this erythropoietin is produced on pericapillary cells of the kidneys, once the kidney function comes down, the production of EPO also come down, and this leads to decreased production of RBCs. So that is the reason why the most common cause is erythropoietin deficiency. Second is iron deficiency. Iron deficiency can be because of nutrition, because of uremia, they cannot eat. There is a functional iron deficiency because the iron is not easily absorbed or carried in the production of RBCs. Third is decreased absorption from the gut. This is iron deficiency anemia. So again, the anemia can be because of vitamin B12 deficiency. Again, it because of decreased absorption or decreased nutrition lead to macrocytic anemia in CKD patients. Also, there can be folic acid deficiency. The patients on dialysis, there can be vitamin B12 and folic acid deficiency because these are water soluble vitamins which are lost in the dialysis. Okay, this is about vitamin B12 deficiency and folic acid deficiency. And fourth cause is during dialysis, there can be a loss of blood because the blood has to be removed from the AV fistula or AV axis, and it has to go to the dialyzer to get dialyzed. So there can be a loss of blood during dialysis. The other causes, because in CKD patient, because of uremia, there will be platelet dysfunction. Because of this, there can be a GI bleed, or uremic ulcers can be there, and from there can be bleed. And most of the CKD patients will be on antiplatelets, and this antiplatelets can cause erosions of the gut, and there can be a bleed in the GI tract. So these are the most common cause for anemia in CKD patients. So how do we treat anemia in CKD patients? So the first more thing is because there is a erythropoietin deficiency. First we evaluate everything. Is there any iron deficiency, vitamin B12 deficiency, or other causes of anemia? If we are suspecting it's because anemia of CKD, then we give erythropoietin. And also we see if there is a stat is very less than 20, then we try to increase the iron supplements. IV is preferred over the oral. We also see vitamin B12 deficiency or folic acid deficiency if this anemia is not getting corrected. Also make sure there is a loss of to prevent the loss of blood externally from AV fistula or GI tract. So these are the way of treating anemia in CKD. There are newer drugs like desidustat, that is hypoxia induced factor inhibitors, receptor inhibitors, where again there is increased production of EPO, where these are oral tablets, whereas erythropoietin and darbepoetin are given IV or subcutaneous. So nowadays we are using this desidustat as orally, that is 100 milligrams thrice a week. So we are seeing a good result in that. There are newer drugs, I think, which is not yet come to the market. So erythropoietin and long-standing erythropoietin like darbepoetin are the newer drugs, we can say. So this is regarding anemia of CKD or anemia, because in what we see in CKD, and that this is how we manage it. Thank you.